Good afternoon and welcome to Saturday Sesh. My name is Trey Reckling. I'm the founder and director of Academy of Cannabis Science. We've been doing this work for about 9 years to work with community members, and that passion grew into not just people working with people throughout the states, but we've ended up having students from Guam to New Delhi, Transylvania, all over the map. And our class today kind of represents that. We have folks all throughout the United States, and it is our pleasure to welcome Dr. Peter Grinspoon today to talk to you. Dr. Grinspoon is decorated cannabis hero who's worked not only dedicated his life to the knowledge of cannabis science, the application of cannabis as a medicine, but also a lecturer. He's a full-time physician. He's also an instructor at Harvard University and the author of Seeing Through the Smoke, which we're going to talk about some today, and highly recommend a very comprehensive approach and very fair kind of dual view approach to many topics. You know, there's so much miseducation that goes on in our community, and so we really want you to take a chance to take a look at that. But Dr. Grinspoon, it is our pleasure to welcome a true cannabis hero to Saturday Sesh today. How you doing?
I'm doing great, Trey. Thanks for having me.
Absolutely. To get us started, for folks who may not have read your book, may not have been introduced to you online yet, could you tell us a little bit about kind of reaching back? I know one of the people you dedicate your book to is Danny, your brother. Could you talk to us a little bit about how Danny inspired this whole deeper dive into cannabis?
Absolutely. Well, to start, my dad was a famous cannabis expert, Dr. Lester Grinspoon. He was awesome. He was a psychiatrist at Harvard for 50 years, and he wrote a book in 1971 called Marijuana Reconsidered, taking a curious approach to the harms and the benefits, a really amazing discussion of the social history. But he concluded in 1971, at a time when only 12% of Americans supported legalization, that the harms of criminalization were always worse than the harms of actual cannabis use. So my dad called for legalization in 1971, a long time ago, and um, support for legalization went up for about a point for each of the 50 years he worked on it. So to start with, I grew up with a lot of cannabis advocates and some detractors in my living room. There was always like the peace pipe going, people were arguing and debating and stuff. So a lot of the early founders of Normal and people like that. But then with my brother Danny, when I was growing up, my brother Danny fought an unsuccessful battle with childhood leukemia. He passed away when I was like 8. But in the last year or so of his life, my parents bought him cannabis, very illegally, right in the early 1970s at the start of Nixon's war on drugs. And it was amazing to see the difference. When Danny didn't use cannabis, he'd be lying in his bed, sort of alone in the dark, barfing into like a wastebasket by the side of the bed. And when he did use cannabis, he could eat, hold down food, maintain his weight, play his guitar, which he loved doing, and most importantly to us, play with his little twin brothers. So from a very early age, I had a idea that cannabis can be a helpful medicine, at least for something, for some people. And that sort of inoculated me against a lot of with that and my dad's activity and all the activists that I was exposed to sort of inoculated me against a lot of the nonsense they teach you about cannabis in medical school. And I've been treating people with medical cannabis for a quarter of a century and writing about it. And as you mentioned, my most recent book was Seeing Through the Smoke. And it talks a lot about the social history. It's very data driven. It talks about the harms, like the real harms and the imagined harms, which are actually things we should be worried about and which are things that were sort of like fabrications of the war on drugs. So there are a lot of both actually. And the benefits, what are the real benefits and what are the benefits that people claim that aren't really proven yet? And then I have a chapter which is a little bit controversial for physicians on lifestyle enhancement, because a lot of doctors feel like all drug use is bad. And, unhealthy drug use is obviously bad, but I don't think all drug use is bad if it helps people, expand their consciousness and connect with other people. So anyways, I've been interested in cannabis my whole career, and here I am today. So
Yeah, you grew up, yeah, like you mentioned, your doctor, certainly a cannabis hero out in front when kind of a voice in the wilderness of sorts. And you talk about in your book growing up and sitting around while people like Dr. Carl Sagan are in the house, and other philosophers, authors, researchers talking about this herb in ways that other people just were not. So how challenging was it to go from growing up like that, then to go into Harvard Medical, which at the time, obviously there were some enlightened folks, but go into Harvard Medical with all that background when the world didn't necessarily see the cannabis in the same way.
Well, it was very confusing and challenging well before I got to Harvard Medical. I mean, just going to like the DARE program in junior high school was really confusing because, I knew they were lying and like I associated cannabis use at home, not only with healing because of my brother Danny, but with like as an intellectual stimulus, is like with laughter and really interesting conversations. And I knew that it didn't make people amotivational at all. I mean, I like there was no way I saw so much of it growing up. And then you go to the DARE program and they fill you with all this nonsense. It was like cognitive dissonance the whole way. Though I do think that a lot of the other kids realized. Sorry, my dog's about to have a barking attack. I know a lot of the other kids didn't really believe the DARE message either. But I had a really, really sort of intimate education in how the DARE message was completely not true. And then, yeah, going through medical school, they teach you a lot of nonsense. It's getting a little bit better over time. They still don't teach the endocannabinoid system in most medical schools, but what people were being taught is a little bit better. But when I was in medical school in like the mid 1990s, what they taught you was, they had to talk a little bit about the chemotherapy and how it helps people, but they mostly made it sound like a scary, dangerous drug. I mean, it sounded just like they portrayed it just like cocaine and heroin and methamphetamine. So we have a long ways to go in terms of educating doctors. But I'm happy to say that we're heading in the right direction. That chapter 4 of my book is called "Do Be No Harm," and it's all about how the doctors were like in favor of cannabis when it got criminalized in 1937. One of the leading voices against criminalization was the American Medical Association, and then the doctors got like beaten down by the Federal Bureau of Narcotics and then by the DEA, became completely against cannabis and like really participated in the war on drugs in a way that like is so horribly harmful to patients. And now about how doctors are slowly starting to turn it around again. So anyways, lots of stuff to talk about.
Well, and on that note, I mean, I guess it's to be expected from some doctors since a lot of the research was so tainted, was so one-sided. And you talk in your book about the links that prohibition-focused research went to try to prove harms, and including some real disturbing animal testing and that sort
Oh,
of
that
thing.
was horrible. Yeah, I didn't even know if I wanted to put that in the book. They give monkeys and dogs like the equivalent of like 500,000 milligrams of THC, and they couldn't kill them, which showed that it isn't possible to fatally overdose. But it was a pretty ugly experiment. There are three problems with our research base with cannabis. Number one is for the last 50 years, 70 years, we've only been trying to find harms. To get any funding into cannabis research, you had to show a drop in something: IQ, sperm count, motivation, none of which turned out to be true. But all of the research in cannabis, and now even recently, 20-1 is focused on finding harms. So you have to sort of factor that in. I talk a lot in my book about how, like, you have to sort of disentangle the science from the social history. You can't just throw away all the science because it was done with a finger on the scale to try to find harms because it still is science. But I sort of view it like you'd view like the baseball player who was on steroids who had the home run record. He did hit all the home runs, but he was on steroids. So it sort of counts and it sort of doesn't count. But then, so number one is that we've been just trying to find harms in cannabis research. Luckily, this starting to change, and it's starting to change in Europe and Canada and Israel and other places where they're starting to do more independent cannabis research. Number two, most of the research we've done has been on illegal cannabis with whatever in it: toxins, heavy metals, leads, fungus, sitting in someone's basement, flooded basement for 3 years. And it's going to be really, really interesting to do research on legal cannabis, which is tested for all of these things. And the dose. And the third thing is almost all the research has been on smoked cannabis. And as a physician, we don't usually recommend that people smoke it because there are combustion products which are unhealthy. It's never been associated with emphysema or lung cancer, but it can't possibly be helpful or healthy to smoke cannabis. Now, someone's dying like from cancer, like my brother Danny let them smoke, or someone in chemotherapy and they need like immediate relief, they might want to take a puff before they throw up. But generally speaking, a lot of this research is on smoke cannabis. And for example, 2017, the National Academies of Sciences, Engineering, and Medicine said that yes, cannabis was associated. Of course, associated doesn't mean caused, but you can't really do studies on pregnant women. It's unethical. So cannabis was associated with low birth weight in women who smoke cannabis. But they speculated that it might have been the smoking of cannabis, not the cannabis itself, that caused the low birth weight because of all the combustion products. So it's going to be really interesting to see, to watch, hopefully, these associations disappear when they start studying, edibles and tinctures, not just smoke cannabis, or maybe the associations won't disappear. But again, our cannabis research has been done in the context of a war on drugs, which was only interested in finding harms, on illegal cannabis, which is much more dangerous, and on smoked cannabis, which is not the healthiest way to consume it.
Also in your book, you have two terms that are really interesting, and you talk about two perspectives that are very distinct. The reefer pessimism, some of the prohibitionist thinking, and cannabitopianism. Could you talk to us about how you define or loosely define the two, and kind of what's at play there?
Sure. Well, first of all, I make a disclosure in the beginning of my book that I'm more pro than anti, because it helped my brother and it's helped me in the past and it's helped thousands of patients over the years. And I'm just against the war on drugs and against criminalization. I'm even in favor of legalizing other drugs and just regulating them really well. I think that a lot of the harms come from the criminalization. So I make that early, but I did want to argue the book from both sides. So the reefer pessimists, I sort of gathered for each thing we talked about: addiction, pregnancy, does it help with autism, all the different topics, driving, how dangerous is driving. I tried to argue it from the pessimist point of view, and I tried to argue it from the super pro cannabis point of view, the canatopians, like utopian view of cannabis. And there's some areas where I think the canatopians get it wrong. Cannabis is not a cure for cancer yet. It kills cancer in the test tube, but we don't have any human data showing that you could use cannabis, Rick Simpson oil, whatever, to treat the cancer. So if you have cancer, get an oncologist, get chemotherapy and radiotherapy, and use cannabis for the nausea, the vomiting, the pain, the anxiety, and the insomnia. And then the prohibitionists, the reefer pessimists, they still use these derogatory quotation marks around the words medical marijuana, and it's absolutely ridiculous. I mean, there has to be some common ground at this point that, cannabis helps with pain, anxiety, insomnia, nausea, vomiting, spasticity, and MS, and that we don't know that it's safe in pregnant women, breastfeeding women. It could destabilize people with psychosis, and we're worried about heavy use in teenagers. So I think we could expand on this common ground, but from looking at the different editorials or articles in any media or social media, you just get one side or the other, and you get these really strident views. And it's really curious to someone who's really confusing to someone who's new to cannabis, or like kind of curious. They look up anything: nausea makes it worse, makes it better; addiction makes it worse, makes it better; gateway onto addiction, gateway off of addiction. It's so confusing, which is another reason I wrote my book, Seeing Through the Smoke. But I really think that even though I tend to be more pro, I think that both sides have some issues that they have challenges with. And I just look forward to there being more common ground on this topic. It just doesn't have to be another topic that we beat each other senseless over. It doesn't have to be another divisive topic in our society. 94% of people at this point support legal access to medical cannabis. Most Democrats favor full legalization. Most independents favor full legalization, and most Republicans favor full legalization. The people who are against it are the Republican politicians. But all the other politicians, even Trump, is pretending to be in favor of cannabis legalization, which of course, he doesn't care about anything but himself. But it's really amazing that both sides of the debate, both candidates for president, are now saying, I support legalization. I wish my dad were alive to see this. It's really, really astounding, since back in the early dark days of the 1970s.
Yeah, and thanks to you and to your family for really moving the needle in a significant way. I know even the way you addressed that, it was a very humble acknowledgement, but it was wildly significant. And so, for somebody who's been fighting this fight a while, who's heard many detractors who, I'm sure have had a number of people scoff at the stuff that and can back up. What advice, because we're your tribe, right? We get it. We are certainly on, I can't speak for everybody here, but largely Our students are people who are in favor of knowing more, in favor of research, exploring more positive benefits. What would you say to the folks in this room or the people who might watch this video who want to fight the fight, but also just get frustrated or like after this long, you're still telling me, you're still throwing prohibitionist messaging at me. How do you light small fires and keep going? How do you keep your spirit up and know that there's a lot of truth on your side, I guess is the question.
Well, you have to look at the history and how much better things are getting. I mean, it's legal now. More than half of Americans now live in a state where recreational is legal and medical is legal in like 38 states. Every election, more municipalities and states ideally legalize medical and or we're definitely heading in the right direction. I think it's really important. This is me, my personality, to keep I mean, I can be a little inflammatory when I write things sometimes, but I really do believe in keeping the debate civil. You know, like I've debated Kevin Sabet, the head of Smart Approaches to Marijuana, several times. I was just on a panel with him last weekend, and he's completely full of it about almost everything, not everything, almost
Right.
everything. But we can still have a very civil debate, and I could be curious about what his concerns are, and he could be curious. And I just don't like it on Twitter when people are like just abusive. On both sides. I'll post something pro cannabis, and people will be like, I won't even say here what they say, and you say something anti, and I just think that people who are against it need to understand the benefits because tens of millions of people are using it medically, and people who are in favor of it need to understand the harms to make informed choices. If I had a beer at a barbecue, I know that alcohol is not good for me, but I make an informed choice. Fuck it, I'll have a beer. Have 3 a week that can enough to cause cancer. I mean, alcohol killed 172,000 people last year, but I can make an informed decision. And if people don't understand the harms, then they can't make an informed decision either. And it's a little bit disconcerting that like when I tweet anything on Twitter, I know exactly who's going to respond to it based on what the conclusion is. Like if it's something
Hmm.
about how cannabis can destabilize people with psychosis, I'll get yelled at by one group of people. And if it's something about wait, something weird just happened to the screen.
Yeah.
You hear me?
Here. There we go. Yeah, it's looked like somebody might have started a whiteboard. There we go.
Okay, just want to make sure it wasn't just me talking. And the people who are, again, in favor of cannabis, like the government lied about cannabis so much and for so long, and they fabricated harms and they magnified harms, and so people people are just skeptical and like the government doesn't have credibility. But now more of the research coming out is neutral or more neutral. And you really have to look at each study depending according to how strong a study it is, not according to the conclusion. You don't want to say, "Oh, I don't like the study because it was pro," or "I don't like the study because it's anti." I think people need all of us need more scientific literacy, yours truly included. And the more we can look at each study and truly, like all drugs have potential harms, like every single drug and medicine. That's true for everything. If I give you penicillin for your strep throat, 1 in 1,000 people are going to have a really dangerous anaphylactic reaction. That doesn't mean that cannabis isn't, oh, excuse me, penicillin isn't the right medicine to give for strep throat. It just means as a doctor, we use the least harmful alternative. And the only way you could do that with cannabis is to really understand the potential harms. And then you could use cannabis as one of the tools in your toolbox as a doctor. It doesn't cure everything. It doesn't work for everybody, and it does have side effects, but you could use it as the least harmful option, for example, for treating chronic pain, which it oftentimes is the least harmful option. So I just think both sides need to step back a little bit from the emotion and really just pay attention more to the science, especially now that we're coming out of the age where all the science was like magnified and fabricated negatives, and we're getting to more neutral times. I don't know if that answered your question.
No, absolutely. And I believe we're very much on the same page. We talk about trying to act in a way that reflects the spirit of the plant, right? And that would be a civil discourse, right? That would be communication. Um,
But
let
I
me.
understand the anger because some of these people are so outrageous, and it's just like completely. I hate the cherry picking, right?
Mhm.
Like smart approaches to marijuana will be like, teen use will be stable, and then there'll be like from like 12th graders between the second and third semester, it would go up 1%, but overall it would be stable or declining. And they'll be like, aha, teen use is rising. I could really understand the anger and the frustration, but I
Right.
just think you get a lot further if you have a civil discourse and if you just yell at each other and tune each other out.
Let me ask you, Tommy Chong, not a doctor, much beloved in the community, has said all cannabis use is medical. And I know this is one of the things you take on your book, or you speculate, dive into a little bit. What would you say, and maybe not to Tommy Chong, but if somebody says to you, "Hey, I love cannabis. It's improved my life, and all use of cannabis is medical use."
Well, I think a lot of cannabis use is medical use, and it can be very difficult to, it can be a very fine line. But I think it's sort of nonsense that all medical uses, like a dying cancer patient using cannabis, that's medical use, right? Um, a patient of mine that's a construction worker that has muscle pain after doing construction all day, who uses some cannabis so that he or she can go play in their ice hockey league at night. Is that medical or not medical? Sure, it's medical in one sense, but it's sort of recreational in another sense that enables you to do something fun. And then say I, in the past, this may or may not have happened, smoke a joint with my cousins before going to a Who concert at Fenway Park. Like, that's pretty recreational and fun, by the way. But unless you define medical so broadly is to include anything that's fun and relaxing. Sure, if something's fun and relaxing, it's good for you. But I think it's sort of a stretch to say that it's medical. So I would say much of cannabis use is medical, but that's sort of nonsense to say that all cannabis use is medical. I mean,
Fair
it's
enough.
a drug that makes people enjoy dancing, talking at parties, joking, going out to plays, going to movies. I mean, again, you can call that medical, but it's just sort of a meaningless definition of medical. I mean, fun is good for you, sure, but it's not medical per se.
Fair enough. Fair enough. Let me, we're at the bottom of the hour, and we typically turn to our folks in the room and see what questions they might have. Sometimes we have more questions than others, but knowing this group, I imagine there's some curiosity in the room about a topic either we've covered or something we haven't. So have at it. You all raise your hand or come off mic. What questions do you have for Dr. Grinspoon at this point? Because you'll know me, I'll keep talking.
So what?
All right. Well, we're going to come back. Y'all think on that question. Dr. Grinspoon, is there a topic that you would be most interested in seeing researched when it comes to cannabis or efficacy of cannabis as a medicine? I know that's a very big question, but
I have an answer to that. Yeah, I'm interested in CBD and cannabis itself in the treatment for addiction. It's hard to meet someone coming off heroin who says that cannabis didn't help them with the withdrawal symptoms. At the same time, the addiction community very much holds that cannabis makes everything worse and doesn't really help. I've seen it help a lot of people. At the same time, if someone's addicted to like fentanyl, we don't use cannabis as a first line treatment. We use methadone or Suboxone
mhm.
because that's been proven to have a 50 to 80% reduction in overdoses and deaths by overdoses. And cannabis doesn't have that data yet, largely because we haven't studied it. But I just think we need a lot more. I think cannabis can help so many people with addiction, and CBD is very interesting too because that helps people with like cravings and cue-induced physiological reactivity. So I really, really want to see the whole cannabis and addiction, not from the point of view of the drug use. Cannabis is a gateway theory, gateway stepping stone. That's all been disproven, but more cannabis is a gateway off of addiction. I'm really interested in seeing that studied a lot more so that we could move beyond the anecdotal and more into the mainstream sort of medical realm.
So yeah, the terms California sober is sometimes thrown around where people, especially for opioid addiction, go in and say, "Hey, look, I'm off of all drugs, alcohol, with the exception of cannabis." Um, so are you in favor of that approach,
Oh,
or
absolutely. Yeah. No, I'm in recovery from opiate addiction about 18 years, and I've been arguing the whole time for having a broader definition of recovery and for meeting people where they are. We save lives. I mean, you know, the recovery culture has been dominated by AA and NA, which I find, helpful for a certain subgroup of people, but generally speaking, I find them to be unhelpful cult-like groups that are very judgmental. And, they give people a hard time if you use methadone or Suboxone prescribed by your doctor. Oh, you're not really in recovery, you're
Just
resisting one
squeaking
drug
to
to
squeak.
another. And that's just
Are you
completely
just squeaking to
wrong.
squeak?
and completely unethical. And then you have to factor in that people are using cannabis for the recovery, and they're finding that it helps with a lot of the same underlying symptoms, like the pain, the anxiety, the trauma, the insomnia that were fueling their addiction. And then now people are really interested in using psychedelics. And some of the data for ketamine and for psilocybin and for ibogaine is really, really fascinating. So I'm a huge believer in the idea of Cali Sober, where you can define your own recovery pathway and your own definition of recovery. And I think we need a bigger recovery tent. I mean, there are limits to this. If you're addicted to fentanyl, you can't really include fentanyl in
Right.
your recovery. But anyways, I just think Cali Sober. I don't love the name Cali Sober, but I think the idea of like using other substances as part of your recovery is a huge and really important concept. Is grounded in harm reduction. I mean, the problem with AA and NA, Alcoholics Anonymous and Narcotics Anonymous, is they're like either you're using drugs or you're not. But in reality, most people are like somewhere in between, and they could have a very strong and healthy recovery. So yeah, I think we've got a lot of work to do. I wrote something about Cali Sober in can't remember, in one of the magazines. And people, I wrote in Salon magazine, I had something about it, and I had something in a Med Page Today. So if people want to read an article about Cali Sober, I sort of summed up the arguments. I don't think that Cali Sober is yet part of mainstream medicine, but with everything cannabis related, we're slowly heading that direction.
Thank you. Thank you. And we do have some questions, and I'm going to come back to you, Madison. MC asks, are there any studies that are pro cannabis or marijuana for anxiety or depression?
Well, that's a complicated subject. The addiction psychiatrist came out with a piece recently in the American Journal of Public Health saying that cannabis makes all psychiatric conditions worse, including anxiety, depression, suicidality, PTSD, psychosis. I agree about the psychosis, by the way. But the fact is, what they do is they find these studies where like anxiety or depression are associated with cannabis use. And they're like, aha, the cannabis is causing the depression, it's causing the anxiety, it's causing suicidality. But guess what? Antidepressants are associated with anxiety, with depression, and with suicidality. Anti-anxiety medications are, because people who are anxious, depressed, or suicidal take antidepressants. So of course they're associated. Nobody's saying, aha, the Prozac's causing the suicidality or the depression. So I think the psychiatrists have like completely got this wrong, utterly, completely like disbelieve their own propaganda or the government's propaganda. There's a very fine line between them. And in reality, I treat a lot of people for anxiety with cannabis. Anxiety, insomnia, and chronic pain are the three biggest things. Now, depression is complicated. It's a euphoriant. Cannabis makes you euphoric. So of course you feel better if you're depressed. But the question is, what happens to the depression over time if you're treating with cannabis? And it tends to get a little bit worse over time. But that's exactly what happens with the SSRIs. Of course, they don't make a big fuss about that. So I think the cannabis really helpful for insomnia, for pain, and these are things that can really contribute to anxiety and depression. I think cannabis is quite helpful for people for anxiety if used properly. You keep the doses low. A high dose, too high a dose can cause anybody to be more anxious. It's biphasic. And then with depression, I think the jury is still out. I think that with PTSD, I think it can be very helpful to people. You'll never find a bigger gulf, like a bigger chasm on planet Earth between what the addiction psychiatrists think about cannabis and PTSD, that it makes it worse, and every single veteran on the face of the planet who thinks it makes it better. I think that we could do a lot better. The medical community could do a lot better getting rid of some of the a priori assumptions of negativity. But this is something that's finally being studied with more neutrality, and I'm gonna be very interested to see where it all ends up.
Let me ask another question in the chat. Are you working with, or do you have any favorite programs that are with universities for degree seeking students? So if I want to go and get a Bachelor of Science, a Master of Science, or et cetera, in cannabis science, do you have a favorite or?
Well, I speak to a lot of these groups. I don't really have a favorite. I don't really have any way of evaluating them. I'm glad there are these degree programs. Hundreds of thousands of people are going to the cannabis workforce, which is awesome, instead of, going into law enforcement, arresting people. Of course, we still had 200,000 arrests last year, so that we're definitely not done with the legalization movement and all the social justice ramifications. But I'm really happy we have these great degree programs and these great professional programs. But again, I can't really compare one to the other. I think it's really important that these programs try to understand where other people are coming from, like the prohibitionists and the physicians who are against it, and B, take a very curious um approach to like all the new science coming out and really focus on harms as well as benefits, because I think they're equally important.
Thank you. And we have another question in the chat, but I'm going to ask Nicole Lee, who's one of our faculty members. Nicole, you mind coming on and asking the question yourself?
Oh
So
yeah,
you can.
hi. Yeah, hello.
Hey, Nicole.
Hi, Dr. Grinspoon. It's such a pleasure to have you here. Thank you so much for making the time for us. I'm one of the instructors that I teach
Oh, cool.
alongside Trey, and I'm a healthcare lawyer in Washington State. And I also have done some work in cannabis law, specifically professional licensure defense for healthcare providers who have used cannabis.
Yeah.
So sometimes these doctors come to the attention of the licensing board for something that has nothing to do with cannabis, right? But in any case, somehow the licensing board finds out that the doctor has been using cannabis, sometimes for medicinal reasons. And the stance here in Washington State is that there is no there is no way for a healthcare provider to practice safely if they use cannabis for any reason at all. And they have suspended the licenses of doctors here indefinitely due to their use of cannabis. This has been in the news somewhat lately. So I was curious when I saw that you work with the Massachusetts Health Service. Is that part of the physician health program that exists nationally here?
Yeah, well, I could talk for this is a great question, and I could talk for hours about this. I am in recovery from opiate addiction, and to get my medical license back, I had to work with the Physician Health Service, which was part of the Mass Medical Society, and they have one of these in most states to try to help physicians who are addicted. They work very closely with the medical boards. They sort of advocate for the physician, but also drug test them and kind of police them. And then about 5 years into my recovery, I was invited to be an associate director for the Massachusetts Physician Health Service. And I sat at the same table helping hundreds of other doctors with their addiction. So I feel like I understand the idea of physicians and addiction from every single side. And while I thought that physician health services did a great job on a lot of things, they completely missed the boat on cannabis. If someone used cannabis like once or twice, they'd act like they were injecting methamphetamine every 5 minutes. They'd completely freak out. And I argued that like medical marijuana should be an exclusionary criteria, just like if someone takes a drug test and they test positive for Valium, if they have a legitimate prescription, they don't get penalized for having Valium in their drug screen because it's a legitimate prescription. I argued so hard that that should be an exclusion for doctors on medical cannabis. Now, this whole nonsense that doctors can't practice safely after using cannabis, there's very little, if any, hangover after using cannabis. I mean, sure, if you're taking bong hits till 5 in the morning, you don't want to go to work at 9 o'clock in the morning. But if you use a modest amount of medical cannabis, like at 6 p.m., you're totally fine by the next morning to work. That's just complete nonsense and hysteria left over from the war on drugs. And again, this goes back to what I was saying before about how the addiction psychiatrists, who the medical boards tend to listen to, have completely like missed the ball on cannabis like from the beginning, and they still have all these really sort of quasi hysterical beliefs about it, such as you said that you're really impaired the next day. I mean, part of it's a lack of lived experience. If any of them tried cannabis once, they'd understand that you don't have, a huge scary hangover like you would with alcohol, for example. And then it also leads into, I told you this is a complicated issue, it leads into the double standard of cannabis. I mean, doctors are allowed to like take medicinal opiates, benzos, gabapentin, antihistamines, antidepressants. They're allowed to drink alcohol. They're allowed to do so many things that cause a much, much more significant hangover the next day than cannabis. But if it's cannabis, the medical boards want to send you to rehab. And that's the whole cottage industry in and of itself, which is a whole other ugly component of this. But yes, I absolutely agree with you. I think doctors are suffering. They're going through an exceedingly difficult time. The only legal option has been alcohol for any of their distress. Right? In a perfect world, we'd all meditate and exercise and do yoga and eat tofu, and no one would need any substance. But in reality, most people need something at the end of the hard day. 3/4 of doctors are experiencing burnout symptoms. I think it'd be much healthier for them to use a little bit of cannabis than to drink themselves senseless. And I think the medical boards are so far behind on this. They urgently need some education on it, because they're just, what's going to happen is they just continue just like the physicians do to lose credibility in this issue because nobody believes them. So I hope that answered your question. As you can tell, this is a topic that I have a lot of strong feelings about.
Hey, I really appreciate what you said. And if it's all right, I might reach out to you through Trey, because I continue to get these cases. And educating the licensing board, I think you're absolutely right. That needs to be done. Being educated by a cannabis lawyer is less persuasive than being persuaded by a doctor like yourself, who
Yeah,
has.
no, I'm happy to. One of the things I'm most interested in is educating physicians. And, the medical board's tough. They have a lot of fixed beliefs and they don't really like changing their beliefs. But over time, they're going to have to change. So the more we can educate, the better. And thanks for the work that you do.
Oh, hey, thank you so much for your time.
Thank you. Thank you both. Madison, thanks for your patience.
Absolutely. I'm learning a bunch of great stuff, so I do not mind to wait for my question. Most of my questions were actually covered through the other questions, but I will kind of go back. So at one point, you had mentioned, like you were talking about the mental health, the neutral test, like the neutral tests for cannabis rather than like looking for the bad or just looking for the good. And also you had mentioned things like autism. Can you kind of just break down a little bit more of all three of those things? I know that's super broad, but like you were just really going in depth and a lot of cool stuff. And I've kind of gotten like lost in everything that was being said. So I don't know if you could reiterate some of the things you were saying or go more in
Sure.
depth about
Well,
that.
let's start with autism. I mean, when I was writing my book, I was sort of skeptical about the claims that cannabis helps autism. And then as I was writing the book, I became not completely convinced, but much more believing of these claims. And, it's really interesting. The American Academy of Pediatrics is like, how could you possibly use CBD on a kid? But CBD is like an approved medication for childhood epilepsy, Epilodex. It's not, it doesn't mean it's harmless, it could affect your liver tests, but, and it could affect other drugs. But it's really interesting how the evidence is growing and how the doctors are kind of resistant to the evidence. They were resistant to the evidence that it helped with pediatric epilepsy syndromes until there were such drastic videos of people smoking Charlotte's Web and the seizure stopping that they had to actually research it. And I think the same thing's happening with autism. I mean, using mostly CBD with just a little bit of THC, it's really hard to argue that that's more dangerous than the other medications that we bombard autistic kids with, the Haldol, the Thorazine, the lorazepam, the Adderall, the risperidone. So I just think, again, it comes back to this double standard for cannabis. Are there any harms whatsoever associated with cannabis? Whereas what we should be asking is cannabis plausibly less harmful than whatever else we'd be using? Or is cannabis more or less harmful than whatever else we would be using? And again, it's difficult in some realms to answer that question because so much of the research has been biased against cannabis. And also because, for example, with cannabis and pregnancy, you can't just take 1,000 pregnant women, give half of them cannabis and half of them a placebo and see if there are birth defects. That's not ethical. So by definition, a lot of our research is sort of inferential from like looking back at 1,000 women who've used cannabis versus 1,000 women who haven't. And are there differences? Even though people who use cannabis might also use more cigarettes or more alcohol, it's hard to tease out what's what. It's much easier if you could just actually do an experiment on people. So we're getting there. It's slow. It's confusing because it's a whole cottage industry to research harms of cannabis still. There's a lot of funding for it. And I think slowly people are realizing that it's, we need more neutral research. And I think with each topic like autism, addiction, driving, we're slowly getting better research and we're getting closer to like having a more fair and balanced understanding of the issues. I don't know if that answered all your questions. I tried.
Thank you.
No, that really did. Yeah, thank you.
And Caitlin Ryan. Caitlin, thanks for being here.
Hi, good afternoon. So I'm going to actually hop on this train around addiction. I'm the executive director for the Cannabis Alliance here in Washington, and we're working on some legislation for this upcoming legislative session to fund some research about using cannabis to mitigate opioid addiction. Some of this is we need more of that research. And as you said, the body is growing and it's pretty compelling. But also here in Washington, we have the ADAI at the University of Washington, which is addiction, drug, let's see.
Alcohol Drug
Not,
Abuse Institute, I believe.
thank you, Trey.
Nice.
Gosh.
Yeah, they are not
I know.
particularly sympathetic. Yeah.
No, they're not. And they're actually really carrying the banner on, in particular, that cannabis causes schizophrenia. They've made some pretty broad claims about causality even. They just had a symposium a couple of weeks ago where the first half of the morning was that particular message. And then again, also an addiction where cannabis is an addictive substance, the same as opioids, even describing cannabis as a gateway to opioid addiction, which is not at all my understanding of that research. And so I know you've talked a good amount about it, but knowing that we're going to be trying to make this case, not just to get more research, but also to change the conversation, at least with our policymakers a little bit, to get them to start thinking about cannabis differently from other addictive substances. If you have any further thoughts about that,
I have a lot of thoughts. I give
Yeah.
the talk just specifically on this, on cannabis and addiction. But first of all, with the schizophrenia thing, the rates of cannabis users in the 1950s worldwide were like 400,000. The rates of cannabis users now worldwide are like 400 million. It's gone up 1,000-fold. Now, the rates of schizophrenia have been relatively stable at about 1% over time. It changes a little bit depending on how good we are at diagnosing it and so forth and how we define it. So cannabis can't possibly cause schizophrenia if there isn't a increase in the number of schizophrenics with 1,000-fold increase in the use of cannabis. So that's total nonsense. But the fact is, cannabis can trigger or aggravate schizophrenia earlier in people who are predisposed to it. And that's a big deal. If a young adult has psychosis at age 22 versus age 27, that's 5 years of like adult skills they're not learning and 5 years of disability that they're on. So it actually, I don't think it's helpful for people with a family history of psychosis or a personal history of psychosis, but I don't think it causes schizophrenia. Like the truth is sort of a little bit of in between. It certainly can destabilize people with bipolar and worsen their mania. Now in terms of addiction, the gateway theory, I don't have time to really disprove it, but like even the 1998 Institute of Medicine report from the US government said the gateway theories is not true at all. It's, more the alcohol and the tobacco and then the cannabis and then the other drugs. And cannabis is just sort of there incidentally because people who broke the law weren't afraid to break the law, used cannabis and ended up on other drugs. There's no causality. But as we talked about before, many people with opiate addiction and frankly with addiction to benzodiazepines and to alcohol, the number one killer, alcohol, 172,000 deaths last year, are finding cannabis helpful in terms of their withdrawal symptoms and in terms of alleviating many of the conditions that were fueling their addictions, such as their pain, their anxiety, and their insomnia. And as we talked about earlier with California Sober, many people, in addition to Suboxone or methadone, are finding cannabis to be an invaluable component of the recovery. Cannabis can help the opiate epidemic in many ways. You can use cannabis instead of opiates for chronic pain. You could try to get the people who are legacy patients on tons of opiates off their opiates using cannabis, only voluntarily. You don't want to cut people off their opiates. It's not ethical. You could co-treat people with cannabis and opiates, and you end up needing a much lower dose of opiates. And most of the harm from opiates is dose related. Cannabis is very, very effective for withdrawal symptoms, way more effective than any other medication we have. So it can really help people as they're getting on Suboxone or on methadone with the withdrawal symptoms. And then there's the issue whether cannabis works the same way as methadone or Suboxone to directly treat the opiate addiction. I don't do that in clinical practice just because we have so much data with Suboxone. I think it's safer. But I've certainly met thousands of patients who say the cannabis got them off opiates. And additionally off alcohol, off benzodiazepines. So I think it's really, really interesting. We need more research, but I think cannabis, whether it's a direct treatment like methadone or Suboxone, or an indirect treatment for the pain, the anxiety, the insomnia, and the withdrawal, I think cannabis is going to be huge in addiction recovery. And I just think it's unfortunate that the addiction psychiatrists, I think of, not everything they say about cannabis isn't true, but I think they sort of, lost the forest for the trees in terms of like just reading so much negative propaganda about it. They sort of lost their ability to kind of neutrally evaluate, is this helping or hurting patients?
Thank you so much. And I'm going to get in line as well as somebody who's going to do some follow-up with you as we continue to work on
Sounds good.
this.
And I go into this in detail in my book. I have like a really
Yeah.
nuanced chapter about cannabis and addiction and where the gateway theory came from and why it's not true, and all the different studies for CBD and then for cannabis, helping people off tobacco, off alcohol, off opiates, the animal studies, the human studies. And it's just something I go into a lot of detail because it's something I'm really interested in.
Well, and I think we, that seems so common sense to those of us that are in the industry that work with patients that, hear these stories and, especially things like the gateway theory was debunked a while back, but still yet for policymakers and people in the prevention community, they're tropes that still remain. And so having things like your book are really important tools to help carry that message clearly. So thank you.
Thank you. For cannabis, there's like programming and counter programming on every issue. For every doctor like me that's saying it helps the addiction, there are probably 3 that are saying it makes addiction worse. So that just makes it so confusing for everybody. And this group I used to be on the board member for, I love them, Doctors for Drug Policy Reform. They're like, we should come up for cannabis competencies for physicians. And I'm like, great idea, but what do you do if half the physicians think it makes anxiety worse and half of them think it makes anxiety better? How are you going to come up with competencies to, educate doctors about how to treat anxiety with cannabis if there's no consensus about whether it makes it worse or better? So I really think educating doctors and getting doctors up out of the dark ages into the modern time zone about cannabis is going to make a lot of this easier.
Let me ask you another question, if you don't mind. Out of the chat, Nick Driscoll says, for medical patients, there's a constant anxiety in this state and others. When it comes to driving, and I know you talk about driving and research regarding cannabis in your book, in one state it'll say 5 nanograms, and another state it's this many nanograms, and
Some states
nobody.
it's any cannabis.
And so, yeah, how
Crazy.
do we square that? I mean, some people are under anxiety that, hey, I'm never legal to drive as a patient. There's not a point in the day that I can drive. So, any thoughts on a reasonable way forward here?
Well, this is going to get better as we legalize, as people have a better experience with cannabis. If people who are afraid of cannabis legalization see that rates of accidents aren't going up. Of course, we don't recommend that people use cannabis before driving because it can increase your risk of accident. It about doubles your risk of getting to an accident, all things considered. Medical patient takes a small amount twice a day. After a couple months, they're not going to be particularly impaired. College kid smokes 10 bong hits after not using for 6 months. They're going to be completely impaired. So it depends a little bit on how much you use and how familiar you are with cannabis and whether you have tolerance and recent experience with it. But generally speaking, alcohol increases your risk of a crash about 8 times, and cannabis doubles it. Now, again, doubling is a really big deal because you can kill someone, crash into someone in a minivan and kill like their whole family. Like you just don't want that on your conscience, or you don't want to deal with the legal ramifications, obviously. But in reality, cannabis, all things being equal, impairs people about as much as all the other things that we doctors tell them not to take before driving, like their benzodiazepines, their antihistamines, their gabapentin, their opiates. And in a perfect world, patients would listen to us. But in reality, people are in pain. They're going to work as a construction worker. They take their Percocet before driving there because they don't have a choice. Now, we tell them not to do that. They do it anyways. So I think it is dangerous to drive on cannabis, but it's not, again, there's this double standard for cannabis. It's in about the same category as all these other drugs, and we need to like include it and work on all these drugs, not just cannabis. And then they just don't have a good way to detect impaired driving. These per se limits of like 5 nanograms, there is no correlation between cannabis in your blood and intoxication. So it would be great if we had something, but they're sort of persecuting people now by saying, aha, you used some cannabis in your blood. That was contributory to the accident, when it just might have meant that you had a couple puffs a week before at a friend's house and had no impairment for a week, and it just still is in your urine. So we need to do a lot better. There's, again, a lot of harm being done. A lot of this is just the law enforcement cottage industry that's had its grip on all this for the whole time. And again, like all things, it's a very nuanced message. We don't want people driving with cannabis, but it is in the same category as the other medications. If you really want to stop fatalities, you focus most of your effort on alcohol, and you need to come up with a reasonable way to detect it that's actually, policing people who shouldn't be driving and isn't just persecuting people who have a little bit of cannabis in their blood. So we have a long ways to go on this issue. We're getting there, but it's pretty tough.
Thank you very much. You know, you've given us an hour of your time today, and it's very evident, I think, to everybody in the room that we could spend a whole lot more time and just begin to scratch the surface. So, as I mentioned to you, our students, our Canna fam is very curious, and so if you all are curious and this has inspired you to learn more, I put both books that Dr. Grinspoon has written here in the chat. So both Seeing Through the Smoke and Free Refills, I would highly recommend you pick up one or both, because it's going to give you a much, much deeper dive into these conversations, into these questions, and more importantly, it's a good read. I appreciate you, Dr. Grinspoon, for not writing something that's can only be read by an academic person. It's really written in plain language and easy to follow, and not just that, but you are a good storyteller, and it's engaging. So highly recommend you all put this one or both of these on your shelf. They're just going to make you smarter, and I know we're a smart crowd. So thank you very much, Dr. Grinspoon, for spending your Saturday afternoon with us. We really appreciate you. Much love to you and your family for not just moving the needle, but continuing to be passionate, continuing to teach, and share the love around in and around this topic. We really appreciate you.
Yeah, well, thank you for having me. I really enjoyed everybody's questions, and I hope everybody has a great weekend.
Thank you so much. You all have a great weekend. Have a great Saturday. We encourage you to join us Tuesday night when we'll be with Mary J. White for Cooking with Cannabis, and we're going to be making lotions Tuesday night. So hope you can join us for that. Thank you all very much.